Hi, this is Grace Dickerson reporting live on Channel 10 News. I'm here joined with Yasmin, who has contracted gonorrhea.
Yes, so I have gonorrhea, and I have it because I had sex with 4 different people, and my butthole itches.
Oh, ow! Yikes.
So I have burning sensations when I pee.
Ow, that sounds really painful.
Yeah, it is.
Did you know that in 2014 there was a total of over 350,000 cases of gonorrhea in the United States? That means that there were 110.7 cases per every 100,000 people. Isn't that just horrible?
It is, yes.
I know. Gonorrhea, also called the clap, is a sexually transmitted disease that many people are diagnosed with. Gonorrhea can cause infections in your rectum, throat, and genitals. This STD can infect people of all ages, including infants. If you'd like to know how one can acquire this STD, prevent this STD, how it can change your life, the symptoms of it, what happens if it's left untreated, and how you can get treatment for this STD, then I suggest that you stick around and turn your listening ears on. There are 2 main ways for one to acquire gonorrhea. One of the ways you can get this disease is through sexual contact, specifically with more than one person.
Yeah.
It doesn't matter if an infected penis goes all the way in or not. You can still get the STD. It doesn't matter if it's vaginal sex, oral sex, or anal sex. Another way you can get gonorrhea is if your mother had it while giving birth to you. As the baby passes through the infected birth canal, it becomes infected as well, which then may later lead on to blindness. There are many different ways to keep yourself from getting gonorrhea. The first and most important one is abstinence. That means not having sex. At least wait until you're married and are ready to start your life before having sex. If you didn't wait before a marriage, then at least be honest with your partner. It may not be the best way, but you always need to use protection. It may save your life. And last but not least, make sure you and your partner both get tested for STDs before having sexual intercourse, because they could have a worse one than gonorrhea. Gonorrhea would be a horrible disease to contract. For instance, if you do end up with gonorrhea, then you are more likely to get HIV. If you're infected with gonorrhea and you become pregnant, then your child could be born blind. If also left untreated, it could cause a pelvic inflammatory disease, which could quite possibly kill you. There are quite a lot of symptoms that would show that you have gonorrhea. Starting off with a burning sensation while urinating, you said that you had that.
Yes.
Many women and men have reported that they just thought it was a bladder infection, which then led them to getting diagnosed wrong. Another symptom of gonorrhea would be an increase in vaginal discharge or vaginal bleeding in between periods. It may take up to 30 days for the symptoms to begin, and then another 2 to 3 days for you to really notice what was going on. For a woman, this may cause spotting between periods and discharge. For a man, this can cause painful or swollen testicles and a yellowish-white discharge from the penis. This may also cause anal itching, soreness, bleeding, and painful bowel movements. This can also cause pelvic pain. There are many different complications if not treated. First and foremost, this could spread to your blood and your joints, which can then cause death. It can cause infertility and/or an ectopic pregnancy. This can also cause chronic pelvic abdominal pain, and you're more likely to contract HIV. You'll have permanent damage for the rest of your life. You can contract a pelvic inflammatory disease, and gonorrhea scar tissue can block your fallopian tubes. They used to treat gonorrhea with penicillin, but now they can't as it's become resistant. They can give you different medications. I couldn't exactly find out which, but it's actually getting harder to treat some strains of gonorrhea because they're becoming drug resistant. If after getting treatment the symptoms continue, you should go back to your doctor. You can go to your healthcare provider or a gynecologist to see if you have gonorrhea. Funny enough, Listerine, the mouthwash some people use nowadays, used to be used as a floor cleaner, and then it was a treatment for gonorrhea.
What?
I know.
That's insane.
It's not anymore because they have become drug resistant to it. But I hope you have been well educated on this subject and know how to keep away from getting it, or how to treat it if you've gotten it. If you think that you may have contracted gonorrhea, then you need to go to your doctor as soon as possible. It can truly ruin your life. Thank you guys for watching.
My butthole itches.
I'm sorry for laughing. I know that's really painful.
It is.
Goodness.
Yeah, kind of wild, I know. And I have burning sensations when I pee.
Ow!
Yeah.
I'll cut that out. That means that there were 110. That means it. Okay, okay.
I'm just gonna cut it out.
Oh.
Clary, off to the office, please.
Okay. Through sexual contact,
That's true.
especially with other people, more than one. It doesn't matter. It doesn't matter if an infected penis goes all the way in. God. Another way you can get. That means not having sex.
Okay, I'm sorry.
As a pill possibly kill you.
I didn't know that.
This is Grace Dickerson and Yasmin, and we're out. Peace.